Good afternoon, it's Dr. Thielemann. I'd like to talk to you about what you can expect after some of your sleep testing may have been done at the sleep laboratory. A vast majority of patients that are referred to sleep medicine physicians are to be screened for sleep disordered breathing of one type or another, often one specific type called obstructive sleep apnea, though there are other types to be aware of. Very often this is treated by what's called a CPAP, an AutoPAP, or a BiPAP machine, and I'd like to speak to you today a little bit more about these machines. CPAP itself is an acronym, CPAP, and it stands for Continuous Positive Airway Pressure. While we're on the subject, the AutoPAPs are abbreviated with the acronym APAP for Auto Positive Airway Pressure, and the BiPAPs, BiPAP, stands for Bilevel Positive Airway Pressure. Now, these are just brothers and sisters, these machines. They operate upon the same principle. They, in simple terms, are air compressors or air blowers. Engineers might call it a pneumatic splint. You plug them into a wall. The devices are usually a couple of pieces of plastic and they snap together. They connect to a hose and to a silicone and plastic mask, of which there are over 100 different types. The air comes from the room. It's not enriched with oxygen except in special select circumstances. It blows the air or pumps it through the length of hosing or tube up to the mask, and the patient wears the mask. The mask is usually the most difficult part to take for a new patient. There are over 100 different types of masks, and you should be aware that you can talk to your supply company or durable medical equipment company if you would like to change them. Otherwise, additional things that can be adjusted on the machine include the pressure or the humidity, depending upon how dry or how wet the home environment happens to be. These machines operate by blowing air into the mask, into the nose and mouth, and the airflow opens up the tissues of the upper airway. They do not allow them to close off so that, for instance, snoring can occur, and so that spells where you stop breathing called apneas and hypopneas that are used to diagnose someone with obstructive sleep apnea occur. So you understand now a little bit more about what this machine is and how it works. What can you expect? Well, as many of you out there may already know, you have sleep apnea of one type or another diagnosed by a sleep study. Then if it's positive, you'll be talking to your doctor about this, and you'll be often coming back for a second sleep study whereby the pressure of a machine such as this will be calibrated. It's not a one-size-fits-all. There are different levels of pressure on these machines, you see. And then after that test is done, the physician knows how to program the machine so that you may use it and it's going to work properly. So you go back home after your sleep test and basically you wait for the phone to ring. Typically, you can expect a wait of between 1 and 3 weeks, although depending upon your insurance, this might be longer. The phone rings and you'll be contacted by what's called the Durable Medical Equipment Company, or DME for short. Essentially, they're a medical supply company. It's a good way to think about it because that's what they are. They'll be contacting you to set up an appointment time for when they can bring a machine to you at your house or have you come to one of their offices. These supply companies are selected based upon which insurance you have. When they deliver a machine, you'll have some different parts of it. The brain and the mechanics of the machine itself, a humidification tank, a mask, the power cord, which usually comes in two pieces, one part that connects to the wall and a second part that connects to the machine itself. And then lastly, a length of hose or tubing. They'll show you how to put the machine together. They'll show you in simplistic terms how to adjust it for some basic complaints, and they'll give you contact information that you can reach them by should you have problems in the meanwhile, just as the doctor also should have done. I hope this has been helpful to you in learning how to use your CPAP, AutoPAP, or BiPAP machine and what you can expect after your titration sleep study has been completed.